Hello, my name is Leonardo Sauer. I'm a Brazilian plastic surgeon, and I'm very pleased to be part of the Global Hair Loss Summit 2022. We're going to talk about the importance of the trichoscopy in the donor area. I have no disclosures, and the trichoscope is the stethoscope of the hair restoration surgeon. This quote, I consider it very important that Dr. Christian Bezanga made and shows how the importance of the trichoscopy for the hair restoration surgery. Trichoscopy is the dermoscopy of the hair-bearing areas performed with a handheld dermoscope or a digital video dermoscope system. And the importance of the trichoscopy in the donor area is to identify any condition that may impair or make it difficult the hair transplant surgery for any patient. So what we should look for in the donor area, we should look for disease, just like this patient that he presented in our clinic to looking for hair transplant surgery. But when we did the physical exam, we identified some patch areas of alopecia, and we made the trichoscopy, and we identified that these areas has no follicular openings. So we referred this patient to the dermatologist. So he made a biopsy, and he had the diagnosis of pseudopelade de Brock, and the patient refused performing the hair transplant surgery according to the orientation of the dermatologist. This other patient presented with these areas of alopecia, and when we performed the trichoscopy, we identified this primary cicatricial alopecia. So we referred him to the dermatologist that made the diagnosis of decalvans folliculitis. So the patient was, this condition was a contraindication for the hair transplant surgery. This other patient presented with androgenetic alopecia in the crown area, but when we performed the physical exam, we saw this patch area in the scalp that was very suspicious of alopecia areata, and the trichoscopy showed some abnormal findings like black dots, curly hairs, caudability hairs, and we referred this patient to the dermatologist that confirmed the diagnosis of alopecia areata, and he is under treatment of this condition and also for the treatment of androgenetic alopecia. At this moment, we are not going to perform the hair transplant in this patient. This other patient also presented with two patches area of alopecia in submandibular area, and we referred him to the dermatologist that made also the diagnosis of alopecia areata. And the patient is under treatment now to reverse this condition. And we also should look for miniaturization in the donor area, because when we perform the hair transplant surgery, we should look for healthy hair follicles in the donor area so we can provide a good coverage for the recipient area. So some patient may present with Hamilton-Norwood pattern of androgenetic alopecia, but shows some signs of miniaturization in the donor area. So we use these parameters from Dr. Jose Lorenzo that he describes the patient with androgenetic alopecia with the type of baldness within the Norwood Hamilton classification, but he has more than 50% of miniaturization in the donor area. And he also the patient may present one or more of the following characteristics. And we also should look for scar in the donor area. When we see these areas of scars, it shows us that the patient has less hair follicles available, whether the scar was made by hair transplant surgery FUT or FUE. It shows that the patient has less hair follicles available, and also these scars may impair the the scar can distort the normal anatomy of this area, and the patient and the surgeon may have more difficult to harvest intact hair follicles. So the presence of scars shows to the surgeon that he has less hair follicles available, and the anatomy may be distorted, and the surgery may be hard. May the patient may present a difficult case to harvest intact hair follicles. So we should start doing trichoscopy, providing a good device to examine the hair bearing areas, and also we should study the atlas of trichoscopy to identify the normal findings of the trichoscopy, and also the pathological findings of trichoscopy. The trichoscopy is a fundamental exam to evaluate the feasibility indication of the hair transplant, and the trichoscopy should be done not only in the recipient area but also in the donor area. Thank you very much.